Good evening. It is 5:30. We're going to call the special meeting to order. Before we start, I'd like to remind you to turn your phones to silent or vibrate, and then let's stand and do the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Chris, would you take the roll, please?
Councilmember Stevens?
Here.
Councilmember Myers?
Here.
Councilmember Berg?
Here.
Councilmember Dalby?
Here.
Councilmember Rowe? Mayor Lazio?
Here. Need a motion for the approval of tonight's agenda?
So move.
Second.
Thank you.
Councilmember Stevens?
Yes.
Councilmember Myers?
Yes.
Councilmember Berg?
Yes.
Councilmember Dalby?
Yes.
At each meeting, we always give citizens a chance to comment on any item on the agenda. I don't see anybody that I recognize in the audience wanting to do that, so we'll move on to item number 1.
Resolution number 66, 2021, setting April 6, 2021 as the date of a public hearing approving the plan, specifications, form of contract, estimated cost, and letting for the Rehabilitate Runway 422 project for the Ottumwa Regional Airport. Recommendation: pass and adopt resolution number 66, 2021.
Is there a motion?
Move the recommendation as presented, Your Honor.
Second.
Thank you. And we'll have Phil give us some background.
All right, so we were alerted to an opportunity where there's some funds being presented by the FAA for projects. We had a project in the queue that would qualify for this, and you can see it's looking at 100% of that project cost being supported by the FAA, not coming anything out of our airport fund balance. And so in order to do that, there's a very short time frame. We actually have to have this approved, I think, by the end of next month. And so we wanted to make sure we had the public hearing scheduled, and then at the next meeting, which would be next Tuesday, we'd hold the public hearing to let those bids and then be able to receive those back in time and have that on the future council agenda for May 4th approval if we get numbers that are good.
Any questions for Phil? Hearing none, take the roll.
Councilmember Stevens?
Yes.
Councilmember Myers?
Yes.
Councilmember Berg?
Yes.
Councilmember Dalby?
Yes.
Consideration of master services agreement with Invisio for a cloud-based planning and performance management solution. Recommendation: watch the presentation and consider approval of the agreement with Invisio for the implementation of a cloud-based planning and performance management solution for fiscal year 22.
We'll turn this
The
over.
recommendation as presented.
Well, it's just going to be a presentation, so I think we just,
Well, there could potentially be a recommendation, but I think if you want to watch the presentation first and then determine if there's any further action. So last August, City Council had adopted the revised comprehensive plan. It's a 20-year document taking in a number of facets across the different services provided by the city, including infrastructure and other major projects. Additionally, there are a number of other planning documents the city uses from time to time, such as capital improvement plans, affordable housing, comprehensive outdoor recreational plans, looking at broadband as one of our options, and those just to name a few. A lot of times, unfortunately, those documents, after they're drafted, may pull a few key pieces of information out of those, and then they may sit on a shelf until some other point in the future where somebody remembers that we did that, and maybe there's some information that could be gleaned from that. Well, Invisio is a planning and performance management. It's a cloud-based solution that helps to address and identify these issues. And we'll see a presentation here in a minute, but it's designed specifically for the public sector to help build trust with stakeholders, helping with executing the plans, tracking and improving performance, and communicating those results. Staff, council, even the public will be able to see in real time the status of any identified deliverables. In addition to viewing and tracking the success of planning documents, it can help serve as a performance driver for staff, maybe a great asset in annual or more frequent staff evaluations, and can also help to identify a number of different reporting features that may be important to the community, tracking some things such as crime statistic data or building permit data. The cost of this is $20,000, which gets you 2 plans for an unlimited amount of users. For each additional plan over 2, there's a $2,500 price to that, and a one-time setup fee of. So we're looking at this into the next fiscal year, July 1, which gives us time to hire that director of community development to help with implementing legacy for some of their one-time small amount money to help with that one-time setup fee. So with that, and we can take any questions in a moment, but I'll maybe turn it over to Madison with Invisio, and he can do a presentation for us. Madison, are you on the line?
Yes, you have me. Can everybody confirm that you can see and hear me?
Yes, we can.
Okay, wonderful. First and foremost, I'll just quickly introduce myself. So my name is Madison. I am the Director of Sales here at Invisio. I've been with the organization for 5 years, and my role is working with municipalities really across North America and understanding what they're doing in the way of planning and performance, and identifying and going through an evaluation to determine whether the technology that we offer will be able to improve and provide some efficiency within these areas. So I've explored conversations with Phil, as he alluded to, and today's purpose is really the following. So we're going to be demonstrating how the Invisio solution can help the city of Ottumwa execute plans, measure performance, and communicate results. Throughout the presentation, I will focus on the following: managing the strategic plan, departmental action plans, capital projects, and other key initiatives across the city, being able to collect, analyze, and visualize performance data. Phil provided the example around building permits, fire response times, police response times. I'll show a number of examples that other cities are doing in this area. And then thirdly, being transparent and having the ability to monitor and communicate all the great work that you're doing with all your constituents. So with that, I'm just going to quickly provide an overview of Invisio, and then I'll jump into the application. So in terms of a conceptual or framework in which you can think about the software solution, it's really the following. So first and foremost, it's about planning, taking those priorities that have been established through the strategic planning working session, let's say, and having a place to put that and identify who's going to take responsibility. And then having a system of accountability to really drive that execution so that plan's not sitting on the shelf, and being able to measure progress in a quantifiable way using all the data that's probably spread out in various different spreadsheets of the organization or in different systems. And then lastly, how do we communicate that? How do we create reports for council so that we're making sure we're moving the needle on our goals and our some of those key projects that are underway. So I'm going to just segue in to taking a look at this. We should be looking at what is the software. So this is the user's experience when you log in. And what we're looking at is a citywide strategic plan in which we've identified our strategic priorities, our goals, and our actions. So I believe one of the recommended actions coming out of your recent strategic planning working session was the ability to create action plans and align that to goals to really demonstrate what the city needs to get done, again, to move the needle. So that's what we're seeing here. So we can create a whole bunch of actions, have them align with our goals and our strategic priorities, and we can measure performance and progress. So here we see different reports. I'm now just transitioning over to analytics, where I will just take a look at a couple different department examples of data. So here is a building permit dashboard that a city is using. You'll notice all of these graphs and charts are interactive. They can be shared internally, but can also be made public. example of a police. So we're looking at calls for service, average travel time minutes, etc. A number of this information you may be reporting on, but it's just displayed in a spreadsheet format. We kind of help bring that to life a bit and make it a little bit more interactive so we can engage with it and really start to analyze and understand where there's some opportunity for improvement, and also on the contrary, what actions actually contributed to improvement. So many of our customers will create monthly progress reports. So we can take a look at of the strategic priorities and goals and actions that are being worked on, what is the status? What is the overall progress? And these reports are automatically generated, a significant amount of time when it comes to consolidating updates and then actually being able to display that on a PowerPoint, let's say. Here's just another example of an operational report typically used by city leadership are being worked on, and that we have an idea of what action are perhaps falling behind, and having those resource allocations. Lastly, many of the communities that we work with also have transparency initiatives. They want to be communicating out with residents and public on the projects that are being carried out and highlight some of those. So Invisio enables the ability to create a website that can be your city website. So navigate through this site, I just want to preface that decide what is shared out publicly. So residents can click through and see what projects and what the overall progress and status is. To share with you a neighboring community, so Village of Lamont, Illinois, they have been using Invisio for a number of years, and this is what they're sharing out with their residents. They have a 2018-2021 strategic plan, and it consists of 6 different strategic priorities. Within these priorities, they have a number of goals, departmental goals and city goals and performance measures that they're tracking and reporting on. I'm going to pause here and allow for any questions that would be directed at myself or Phil.
Any questions, Council?
Oh yeah, I was wondering what kind of time commitment do you think, or does it seem to be to maintain this? Because it's great. I think it looks great and would be a great usage, but obviously maintenance is always something to make sure that we have the ability to do.
Right. Well, I'll just start out from my understanding of it and allow Madison then to follow up with anything. So my understanding from conversations with Madison is a lot of this is, as far as the statistics and other things, is information that's pulled from resources that we already have. And so once we have that part established, then there should be very little maintenance month to month or those things. So it's identifying things that we want to track, things that we maybe already are tracking, and then getting them collected into the system. The other part of that is to get things set up. If I remember correctly, there's like a one point person. Again, it'll probably be that director of community development, and then a couple of others that help assist that person with getting the information and uploading into this. And then it's just a matter of training people how to use it. As far as with the action plans and those things, it may be a matter of you pick a point in your day, you log in, you see if there's anything that you're tackling that day. Once you have that completed, you go back in and say complete, and it'll feed that up. So the action is done, feeds into the goal, a little bit more percentages complete, et cetera, et cetera. Anything to add there, Madison?
No, that's quite accurate. There is the initial lift of getting the plans and the data inside the software and assigning roles and responsibilities. But once we've done that, then the ongoing maintenance is just a case of coming into the system on a monthly basis to provide your updates, whether that's qualitative or quantitative. And we use Invisio here, and I know a number of customers where we're asking nothing more than 30 minutes of staff time on a monthly basis to come in and provide their updates. And that feeds into all of the reports and dashboards that then give us the visibility over where we're at.
So if I may, Phil, that kind of, I think he answered my question, and you did too partially, but it was kind of like who on staff is responsible for inputting? And you mentioned this communications position. And then I think according to Madison, it would be department heads, whether it's the 30 minutes a month or whatever, they would be responsible for inputting into the system.
Yeah, so I'd say it'd be our department heads or whoever they designate. But a lot of this is just trying to get that communication out to the public, things that we should be doing on a regular basis anyway. This just provides a tool to more efficiently do that, and hopefully in a more time efficient manner as well. So taking less time and hitting more people. Like you said, once that information's in there, it's a click of a button to print a report. And a lot of the times that can be done, whatever part is publicly faced information. So if there's information that the public can access that is out there, they can go in, they can look at the reports on their own. If there's things that council needs, they'd be able to go in and access that information, or we'd be able to print and prepare and give a report to the council if that's on a monthly or quarterly basis.
Phil, I got a quick question, just so I understand it. Is the community development person going to be tasked with making sure that the people who are inputting this stuff are going to be doing it, in somewhat of a timely manner? Is it going to be kind of like I don't know what you call it, accountability type position? Because I can just see coming in and wanting a report run, and then only half the information's in there. Is there going to be some consistency in having all the departments use it and use it regularly so that it's good information and current? That's my concern.
Yeah. So when I mentioned the director of community development, they're kind of in charge of at least the first couple plans that we're looking at with this is the comprehensive plan and I think that strategic plan. The other one that I was looking at the potential of doing is capital improvement plan, but that depends on where we're at with that process, or it could be some other plan that we have for that third one. But the two ones that I would start with that we have ready, comprehensive plan, strategic plan, fall into the wheelhouse of that individual. So they would help with getting that, be the point person to get this up and running. But from there, it's really on myself and working with the senior leadership to make sure that it's being done and carried through the organization.
Great, thank you.
Phil, is there, knowing that we're working towards hiring that person, is there a reason to approve tonight, or is it worth, waiting till that person's onboarded to make those decisions?
Yes. So the one advantage of looking at that tonight is talking with Madison. We would have the ability to get a third plan for that initial cost of the $20,000. So whereas normally you only get two, we would be able to get three, and that's and I'm assuming it's sales numbers and other things to be able to say, hey, we got another community by end of quarter, which would end tomorrow. Having that knowledge that they can say that we're on board gives them the ability to leverage that. So that's the reason for doing it tonight versus a month from now or 2 months from now.
Phil, if I may too, then on that order. So the initial 20,000 and then the 5,000 startup.
Yeah.
And then the following year, it's not another 20,000, is it?
No, I believe it's the same every year that we're using it, correct, Madison?
Correct.
Yeah.
Yeah. So it's 20,000, like 25,000 for the first year. Second year would be 20,000 ongoing.
Yeah. Unless you added any plans in between there.
Correct.
And what's the long term? Can we choose to not use it at any time? Or is it a multi-year contract? Or?
Well, the initial agreement here was a 2-year agreement, and you'd be able to add on years after that. So, I mean, there could be some cost of living adjustments in future agreements in addition to additional plans. But other than that, yes, you could choose not to do it at any point after that.
And then my last one. You mentioned legacy as possible source initially, but then would we include it in our budget hereafter? And you said July, so is it okay in our budget for?
Yeah, so with legacy, I'm looking at the one-time $5,000 fee that fits within one of the director's abilities to leverage those funds. And I've had an initial conversation. There's no commitment yet with that. I haven't officially asked for it, but there's a possibility there so that the one-time fee could potentially be covered by legacy. And then, yes, budgeting it in future years as well.
Thank you.
Any other questions for either Madison or for Phil?
Phil, do you believe that the fees that we're going to be paying to use this, and I'm going to go on the notion that it's going to be used correctly and be up to date, because I know that you guys are well in charge here, but would you say, in your opinion, that it's value added, that the money we'll be spending on year after year is going to be something we definitely get good value out of for the money? Because it's a pretty big expenditure.
Yeah, it is. And I don't know the exact figure, but we spent somewhere in the ballpark of $150,000 for the comprehensive plan. And any other plan is anywhere from probably $20,000 to $50,000 every time the city institutes one of those plans. To have, the value I see, the value added, is to be able to make sure that those plans are carried forward and that we have full knowledge, myself, city council, other staff, and the public, to know that what we spent that money on is being seen through. And a lot of the things that we have in the comprehensive plan, one of the 4 qualities or 4 tenets there is housing. So we add housing and we see that plan through and we can see the progress there. You're going to be seeing increased assessed values, and that is going to cover the cost of this, tenfold.
Well, just the transparency part alone, being, allowing the public to actually see if our comprehensive plan is being followed and to what extent it's being followed, that's value added, I think, right there. So I appreciate that.
Yeah, definitely. And being able to communicate our successes, the results of the things that we're doing as a community to help to continue the changes that we've been making in our culture and attitude, just creating a positive place to live, quality of life, inclusiveness, those are all things that were in there as well. And to be able to see and document those things that we're doing towards those ends, I think that says a lot about us as a community, and that, we're investing that in our future.
Sure. Thank you.
So is there council desire to take any action tonight?
Well, I would go back to, again, making saying yes to the recommendation. Let's pursue this.
Would you like to put that in the form of a motion, Mr. Myers?
Yes, sir.
Okay.
Second.
Holly is going to second that we go ahead with the purchase of the Invisio software package. Any other questions for Phil or? Okay, hearing none, take the roll.
Councilmember Stevens?
Yes.
Councilmember Myers?
Yes.
Councilmember Berg?
Yes.
Councilmember Dalby?
Yes.
Thank you very much.
All right.
Thank
Thank
you,
you,
Madison.
Madison. We'll drop you off the line here then.
All right. Thanks, everyone. Take care.
Thank you.
Fiscal year 22 health insurance renewal work session. Recommendation, receive presentation from Mark J. Becker and Associates to review the health insurance renewal information for fiscal year 2022.
Good evening, Kayla, Finance Director. Are you going to introduce this?
Yes. Good evening, Mayor and Council. I'm going to turn over to Nick Brown with Mark J. Becker and Associates, and he's going to give you a presentation regarding our health insurance benefits. And as we go through the presentation, if you guys have any questions, just let us know. And or if you have any questions for myself or Phil as well, we can answer those as he's going through these presentation notes. Okay.
Okay. Good evening, Nick, and welcome to Ottumwa.
Good evening, Mayor and Council. Thank you for having me here tonight, and thank you, Kayla and Phil. As Kayla mentioned, my name is Nick Brown, and I'm here with my colleague Brenda Plants, and we are representing Mark J. Becker and Associates tonight. We have been working with Phil and Kayla extensively on your benefits policies and package here for the last few months, and so we are delighted to be in front of you this evening. I am here today just to give you a quick overview of the recommended renewal. So I'm going to start with a quick executive overview here. The recommended changes do not have any major plan design changes. So that is the good news. The bad news is that the needed renewal increase this year, if you were to do absolutely nothing, is about an 11.5% increase. But through some network and formulary changes, we're able to reduce that 11.5% increase down by 8.5%. And so that's going to be actually an under 2% increase from your current rates. Now, the other thing that we're doing this year is we're going to try to actuarially align your tiering. So there's just been a little bit of for lack of a better term, some manipulation of the tiering. And so we're going to try to get that back to a more actuarially sound principles. And then from a dental perspective, last year you added a dental plan, but given where your rates are today, we can actually get both of your plans back to one plan and not back to one plan and not increase premiums for members. So I think there's some good news there. And again, those tiers just to be more actuarially statistically relevant. And then from an ancillary perspective, your voluntary vision 100% of the cost of vision. And there's been some concern over the lack of coverage with vision. So there's some enhancements that we're recommending this year. And then from life and AD&D perspective, you have that is a policy through Symetra, and they are offering a 2-year rate guarantee, which is extending your current rates and then extending your current benefits with no rate change, no benefits, no benefit change either. And from an FSA perspective, this is your Section 125 plan. The maximums are remaining unchanged for 2021, where the health maximum would remain at $2,750, and the dependent care would remain at $5,000 as of today. And so you're on what's called the Alliance Select Network, and that is the most broad network offered through Wellmark. And you have a deductible of $300 for singles, $600 for family, and then your out-of-pocket maximum is on an in-network basis, and the plan would pay the remaining 90% up until that out-of-pocket maximum of either $1,000 or $2,000. And then from an RX perspective, you are on the most broad formulary, or I should say, your members are on the most broad formulary, which is Blue RX Complete. And you have a copay structure where Tier 1 is $10, which is mostly generic drugs. Tier 2 is your typically your preferred brand name drugs of $25. And Tier 3 is your not preferred brand name or your limited value drugs in Tier 3 or 4, and that's a $40 copay. So if we move forward, that renewal column in the middle there is really if you were to make no changes whatsoever. And then the renewal alternate all the way over to the right is the proposed changes or the recommended changes, which is really consisting of 2 major changes for 2021. The first is a network change from Alliance Select to Blue Choice, and I'm going to go through that in detail here on the following slides. And then also changing the formulary from Blue RX Complete to Blue RX Value Plus, which would essentially eliminate that Tier 4, which Wellmark would designate as more limited value drugs. And I'm going to explain that here in a second. So that's kind of the benefit summary. And then this is more of the rate summary. So today, based on your current lives, the plan is costing about $3.67 million annually. And given the way that your claims have been performing over the last 12 to 24 months, our estimation based on the additional fixed fees that are being placed to the city this year would be an additional 11.5%, which would be about $4.1 million. And so we're able to back off that additional $420,000, or it would be an additional $420,000 to the city we're able to back off that by about $350,000 to a 1.9% increase, or less than $70,000, to about $3.7 million in total annual cost. And so that change is mostly due to the changes that you see there highlighted in red on slide 4. This slide is a little bit more detailed in nature, but I do just want to give some caveats and some notes to what we just talked about. The renewal and the renewal alternate, as we mentioned a little bit ago, is adjusting those tiering factors to align with more actuarially sound methods. So the rates that you're seeing on this screen are those more actuarially sound rates. And the claim differentials for the alternate plan designs that we looked at, those are based on Wellmark's estimated claim differential. So we weren't just pulling those out of thin air. Those are actuarially statistically valid claim differentials. And one of the probably more sensitive topics to some people is removing the grandfathered status. I know for people who are on grandfathered plans, the term grandfathered status does have some personal meaning to it. But really, I want to point out, number one, the plan that you're on today is about as non-grandfathered as a grandfathered plan can be. And secondly, the changes that would apply to going from a grandfathered plan to a non-grandfathered plan, all the changes that are listed here are actually enhancements for members. It would impact members negatively, or it would not impact members negatively whatsoever. So the three that would really change is, one is with regards to your infertility benefits. Today, you have a $15,000 lifetime infertility maximum. And by infertility, I mean that $15,000 maximum is geared towards the transfer process of like in vitro fertilization or artificial insemination. Well, today that's a completely separate lifetime out of pocket. If you have infertility benefits, it's outside of your normal annual out of pocket. But with going to a non-grandfathered plan, that actually brings, you'd still have that lifetime maximum, but you'd also, those services would also apply to the annual out of pocket maximum. And then prescription drugs and items and exams for smoking cessation must be covered. And that is a requirement for non-grandfathered plans, that ACA plans do cover those benefits. And then ACA required drugs also must be covered at 100%. So those are all three member enhancements, really. I wouldn't say either any three of those are major cost drivers whatsoever either. And then I also want to point out the alternates that we looked at had a few more detailed provisions that we looked at to just update your language. Some of the provisions in your plan today are a little bit outdated, so we wanted to update to some more modern language. One of those things is covering 3D mammograms at no cost share. Today, 2D mammograms are at no cost share, but we're starting to see more and more importance in these 3D mammograms. So I want to cover those at no cost share to members. That fourth quarter carryover provision, that's an older provision where if you get services in the fourth quarter, that carries over to your deductible in the following year. However, if you get services done in quarters 1, 2, or 3, that doesn't carry over. So just to be more equitable and to kind of clean up some language and reduce the risk to the city, we would recommend removing that fourth quarter carryover provision. Same thing with the common accident deductible, another older provision. It's not going to be a large cost driver. Some of these provisions your members probably don't even know about, but we're trying to update and modernize and also reduce risk to the city. So in a common accident, if you have 2 or more members under one contract that are in the same accident, as of today, it would only apply to one deductible and not multiple deductibles. And then Wellmark to Wellmark credits. If you hire somebody who is on another Wellmark plan at another employer, as of the language today, there's a chance or a likelihood that they would, the deductible out of pocket that they've already met for the year would already be, they would come onto this plan and it would be applied as though they had already met some portion of their deductible out of pocket. So this would get rid of that and they would just start fresh as most people would on a new employer plan. And then finally, injectable specialty drugs would be covered under the drug plan, or most of them would be covered under the drug plan. Today, most of them are covered under the health portion of the plan, and we see some better discounts and some better rebates under the drug plan. So that would be the reason for that change. None of these are going to be big impacts to members whatsoever, but they are just updating and modernizing language. I'm going to come back to this slide after I review the next few slides here. So I want to talk about the Blue Choice difference from what you're on today, which is Alliance Select. So Alliance Select is what the city is currently using, and it's the most broad network offered by Wellmark. You have nationwide coverage, whereas the Wellmark Health Plan of Iowa, of which Blue Choice is a product of. So you can think, for the purposes of this meeting, you can think of Blue Choice and the Wellmark Health Plan of Iowa as kind of synonymous. But the Blue Choice would be mostly Iowa-based, okay? With the exception of the contiguous counties outside of the state of Iowa would also have Blue Choice coverage. The Wellmark Health Plan of Iowa covers 97% of physicians in the state of Iowa. It also covers 100% of hospitals in the state of Iowa. So the in Iowa coverage is very comprehensive. It really is going to feel very similarly to the Alliance Select plan. And the benefit of going to this Wellmark Health Plan of Iowa or Blue Choice is it offers deeper discounts. We know that if your exact same utilization patterns were to occur today under Alliance Select and go into WIPI or Wellmark Health Plan of Iowa, that would be roughly a 6 to 8% claim savings right off the bat. And we know as a self-funded plan, which the city is, that impact's going to be felt immediately and is the biggest reason why we're able to reduce your renewal down from 11.5% down to 1.9. But there's some concern, obviously, for people who are used to Alliance Select or often go out of state or have children who are out of state at college. You know, what does that mean for them? And so for those people who have children maybe going to school out of state, or if they have, for some reason, a spouse that lives out of state, or they are permanently traveling for more than 90 days, Wellmark offers what is called guest membership. And guest membership is Wellmark's kind of workaround in these unique circumstances where they can call customer service at Wellmark and say, hey, this is my situation. Can I please get set up for guest membership? And then Wellmark will be able to help coordinate access of wherever the child or its employee or spouse is located at that time. And then when they come back from school or from their travels, they can just say, hey, I'm back, and then they can resume coverage in the state of Iowa. For coverage that cannot be obtained in state, certainly there is a limitation of what can be done in the state of Iowa, although most things can be done. But if somebody just has to go to Mayo or the Cleveland Clinic for whatever reason, there are specific referrals that members can request coverage at the in-network level from an out-of-state provider. And if someone's traveling out of state and they have an emergency or an accident and they need to go to the emergency room, those emergency services are going to be covered at the in-network benefit. So there's still protection there as well. I also want to point out that WIPI offers, and the Wellmark Health Plan of Iowa offers 3 products: Blue Choice, Blue Access, and Blue Advantage. And the reason that we're recommending the Blue Choice option is because it offers out-of-network coverage. The other 2 options do not. And as a large employer in the state of Iowa, you are required to offer out-of-network coverage. But one other thing that comes with the Blue Choice plan is that it requires the designation of a PCP. And so each member, meaning that the employee and the spouse and however many children, they all have to have their own designated PCP. And that can frighten some people, but I want to emphasize that the only thing that means is that preventive services must be performed by the PCP. It's not a gatekeeper model in the sense that you have to go to your PCP to go see your cardiologist. That's not the purpose of it. But you do have to designate your PCP in order to receive an ID card. And so that is key. Females may designate 2. They may designate a PCP and then an OBGYN if they choose. They do not have to do so, however. And you can change the PCP at any time. You just need to make sure that you are giving Wellmark at least until the first of the following month that you call them for that change to go into effect. And now from an out-of-state coverage perspective, I know that is concerning for people who may utilize Mayo or may want the option to go to Mayo. And I just want to emphasize that if you are seeking a Blue Card provider, which most of the providers that are part of Alliance Select today, such as Mayo, they are a Blue Card provider, you would not be subject to balance billing. You would just be subject to the out-of-network benefits. And the Blue Card program includes 96% of U.S. hospitals. It includes 92% of U.S. physicians. And so as long as the member is protected by those out-of-network benefits, the they are not going to be subject to balance billing. It's really a win-win for the city and then also for the member. And I'm going to go back here to the benefit summary. So today, I'm going to kind of give you a scenarios if someone were to go to Mayo. On this Blue Choice plan all the way to the right, their out-of-network deductible and out-of-pocket is actually the same as their in-network deductible and out-of-pocket. And those aggregate together. So it's not a separate $1,000 out-of-pocket. It's a combined $1,000 out-of-pocket. So the only difference to a member who's going to an out-of-network provider, such as Mayo, as a Blue Card provider, they would have to pay that extra 10% in coinsurance. But if they're going to an out-of-network provider, it's likely a high-cost provider anyways. They're going to hit their $1,000 or $2,000 out-of-pocket. It's just going to get them there a little bit faster, but they're still protected. Let's see here. There we go. The one thing that we'll probably notice the biggest disruption on is from a chiropractic perspective. The chiropractic network in the state of Iowa is certainly the biggest disruption in terms of providers. And that is partly because of who controls that network. It is not Wellmark. It is the Iowa Chiropractic Physicians Clinic that controls that network. And it's a little bit more limited than what is experienced under Alliance Select. So I'm going to go back to the disruption here. And I want to focus on the bottom Iowa portion. So when this report was ran, you had 974 providers that were utilized by your members in the state of Iowa. 953 of those were in your current network today, in the Alliance Select network. So you already have a 2% disruption. If those same providers were used and you had the exact same utilization under the Wellmark Health Plan of Iowa or Blue Choice, you would have an additional 21 providers that would be considered out of network. Okay, so you have a total of a 2% disruption from moving from Alliance Select to the Blue Choice plan. And I can guarantee you that the majority of that 2% is chiropractic care. That is typically where we see the disruption in. Now, if we expand this report and we look at all states and services that you have received out of the state of Iowa, there's a 7% disruption. And so that's a little bit higher than what we see in Iowa only. But again, remember, if you go to a Blue Card provider, such as Mayo, that's going to be not subject to balance billing and just subject to those out-of-network benefits, which we talked about align very closely with your in-network benefits. So before I move on, does anybody have any questions with regards to the Blue Choice change that is being recommended?
So it sounds like even though there's a larger disruption there, there'd still probably be ample chiropractors available in the city.
Yes, there is likely some chiropractors that are available. And we've seen, they can still go get the out-of-network benefit on chiropractors as well. Or oftentimes members use a cash scenario and just set up a cash arrangement with their chiropractors as well. The one good thing, I guess, if chiropractic care is the worst case scenario in disruption, it's oftentimes also a less expensive cost of care versus, an inpatient or outpatient setting. Okay, I'm going to move on then to the Blue RX Value Plus disruption, and this is your drug formulary. Today, again, you are on the Blue RX Complete, which is the most broad formulary Wellmark has to offer. And within that formulary, there are four main tiers. Tiers 1, 2, 3, and 4. Moving to Blue RX Value Plus would eliminate tier 4 drugs only. And this report is shown from September of 2020 through January of 2021. And within that time frame, 21 of your 292 utilizers had utilized a tier 4 drug. So that's about 7% of your utilizers, but only 2.5% of your scripts. So only 57 of your 2,269 scripts within that time frame were actually tier 4 drugs. But those 2.5% of scripts made up 10% of the drugs, or 10% of the drug spend, which is about $25,000. So getting rid of tier 4 is not going to eliminate this $25,000 worth of cost, but it is going to disperse it most likely in an alternative drug in tiers 1, 2, or 3. And that is probably the most important point to make is for every drug in tier 4, there's an alternate in tiers 1, 2, or 3 that Walmart would deem as being more cost effective or having more efficacy. And that is the reason to move a drug into tier 4s when those alternates are available. So we wouldn't necessarily see that $25,000 just go away, but it would hopefully be redistributed in a less costly option. And tier 4 is generally made up of combination products where, maybe a member could take 2 different drugs that do the same thing as that one drug and it's half the cost, or they're lifestyle drugs or drugs with more cost-effective options, as we mentioned. So that's kind of what tier 4 is made up of. And we've seen many clients go to this without any issue. I believe Walmart's large group book of business at this point has about 2/3 of their clients that have moved from BlueRx Complete to BlueRx Value Plus. So it's very common, and I would anticipate low disruption to members. Before I move on to dental and vision, any questions on the tier 4 disruption? Okay. So this is some good news here with regards to your dental plans. Today you have 2 plans. You can have a basic plan, which offers a benefit period maximum of $1,000 a year, and a buy-up plan that offers a $1,500 benefit maximum, annual maximum, and a $1,500 ortho lifetime maximum. And you can see that the majority of the people are on the basic plan, but you do have 6 individuals that are on the buy-up plan. And this was just introduced here in July, so it's relatively new. But given where your rates are set at today, we can actually improve everybody's, well, all but 6, we can improve them up to that, what is today a buy-up plan. And so everybody can have what's now today the buy-up plan at the basic plan rates, which is good news for everybody. And we would be able to keep the total premium the same. We, as we mentioned earlier, we're just realign the tiering to be more actuarially sound. But the total dollar amounts would remain the same as they are today under the basic plan. There are 2 small changes that we would want to tweak, and this is similar to what we just talked about with regards to updating the plan language just to be more modernized. One would be the pediatric oral services. Today, they are not subject to the annual benefit maximum, and that's just a little bit of an older provision. But we've seen many dental plans, and almost all of them are subject to an annual maximum. So we just want to update that language, again, to protect the city. Also, space maintainers today are covered with no age limit, but we know space maintainers are almost always used on younger teens or even before those years. And so we just want to update that language to cover dependent children under the age of 15 with regards to space maintainers. Neither one of these is likely to have any real impact, but we just want to clean up the language. And then from a vision perspective, today there's been some reports back to Phil and Kayla that the vision coverage is not as comprehensive as members would like it. So Phil and Kayla have asked us to find some plan that would hopefully enhance members' experience, and this is what we're recommending tonight. Today, if a member were to walk into a vision provider and ask to see frames, their benefit is up to a $50 wholesale maximum. But it's hard, to walk into a vision provider. Well, what frames are $50 wholesale? You can see the retail value, but don't necessarily know the wholesale value. So to make it just easier from a consumer perspective, we would change the frame benefit from a $50 wholesale benefit to a $150 retail allowance. And really, the $50 wholesale is usually up to about $150 retail. So it's not really a change in that specific benefit, but it's just easier for people to understand. And today, your lens package, if anybody wants a buy-up, if they want scratch-resistant coating or tint or whatever, there's going to be an additional charge for that. It's not covered under the plan. We want to add a lens package that would cover some of that as well. Your contacts benefits today, there's a $130 allowance, but this plan would increase that to $150. So you have a $150 frame, $150 fitted for contact lenses and evaluation, which most people who are in contacts have to go through that process. it's either 100% out of their own pocket or it's taken out from their allowance of $130. Able to add a lens fitting and evaluation benefit where the member would pay no more than $50 in a standard evaluation and no more than $75 in a custom evaluation. So those are kind of the main changes with regards to this benefit plan. There would be no other main changes, but the rates would be going up, as you can see. For singles, they would be going up almost $4, and families would be paying about $11 more a month. And again, this is no cost to the staff. Today, again, if you were to get polycarbonate lenses or scratch-resistant coating, any of those items listed that are checked on the left-hand side, that would be at the member's cost. And you can kind of see what those costs would be in that red box if you were to go to an Invisio's preferred provider. So, it adds up over time. And so for the additional $4 to $11 in premium a month, members are going to be able to experience savings, not only in the increase of the allowance, especially in contacts from 130 to 150, but also to have these add-ons at no additional cost. That is kind of the extent of the renewal update today. Does anybody have
A lot to absorb, but you've done a nice job of giving us a good summary. I think that's very clear. You've made it very easy to understand.
Thank you.
Thank you for the handout as well to follow you, because this is very descriptive, very nicely done.
Thanks.
So Kayla, you're not asking for any action. You're just asking for awareness tonight and get some feedback from staff and
Right.
continue working with.
We would, like any feedback tonight, we'd like to bring this to council next Tuesday, so that way we can roll it out to staff and start our open enrollment. So we can get this to our open enrollment information to Wellmark by May 15th. So that way we can get out new cards to all of our employees and everything.
Sounds good. Council, any other questions?
Just gonna say, is there, what's the process for getting this out to staff for review things before the next council meeting? Is there?
Right. We have, we're going to send out the information to staff and department heads, basically the same presentation, and then we'll be available for questions for any of them, to explain, and I have the rate sheet done that will be sent out as well to explain the new actuarial rates that will be rolling out to staff for whether they're single spouse, employee, children, and then the family plan. And so we'll get all that information out to them if they have any questions, and they can let us know before then.
Thank you.
And then, just to recap a little bit too, when we, talked budget and set the levy rates and everything, we did not go up that 11% from the, renewal, because we would have had to increase our levy rates. So with this reduction of the 350,000 and also the reduction for the 65 plus fully insured Humana plan, this would save the city, the taxpayers, $810,000 for fiscal year 22.
820.
It's about $810,000 for fiscal year 22 with the both plan changes. And again, to go to this Blue Choice plan, it will actually reduce the single coverage by the premium would be reduced by $100 a month, which the 10% to employees is $10 a month. The employee with spouse would be reduced $191 a month, which is $19 a month. The employee with children, it would go up about $80 a month for the premium, and it'd be a cost to the employee about $8. And then the family plan was probably the plan that was the most actuarially unsound. And that plan would go to up to $144 a month for those employees. And right now we have 73 employees that are on that plan, which is about $24 a month that will go up in total for that group. But last year we did make some changes to make it more actuarial sound. So that way, when we got to this point, it wasn't going to be, such a big jump in 1 year. But we have to get to that where the premium amounts are actuarial sound.
Very good. Well, if we have any questions, we'll be calling you. So, thanks, Nick.
Thank you.
Nice
Y'all have a
job.
good evening.
We also give opportunity for public input. Is there anybody that wants to address the council? Have you had any calls or any? Okay. I would like to, just for the sake of the public, put an item on the agenda for next regular meeting, to talk about nuisance and nuisance enforcement, and encourage the council to talk to their constituents and just get some input. Seems like we've had an abundance of calls on nuisance, everything from auto storage, junk, trash being spilled, trash not being covered. And we really want to work on cleaning up our city. I think we have a beautiful downtown now, and we want to work with the Make Ottumwa Shine group, and they are going to be designating May 16th through the 22nd as Make Ottumwa Shine Week. It's a little later in the year, but it'll be right before graduation, and we'll have a lot of visitors in our community, and want to have the city looking its best and continue that. And we've had a great meeting with our department heads and interdepartmental action to help each other do the enforcement that we've been a little bit lax on. And I think as I have talked to a variety of business owners and emails and letters I've gotten, it seems like this is a genuine concern from the public. So be prepared to have your thoughts and ideas, and we'll decide what we're going to do after we have some discussion about it. So is there anything else, Phil, from administration?
Nope.
Anything from the council? Okay, I entertain a motion to adjourn then.
So moved.
Second.
Thank you.
Councilmember Stevens?
Yes.
Councilmember Myers?
Yes.
Councilmember Berg?
Yes.
Councilmember Dalby?
Yes.
6:29.